I'm Bill Martinez. I'm the Director of Forensic Community-Based Services for the Office of Behavioral Health, which is the aftercare outpatient treatment unit for persons who have been adjudicated not guilty by reason of insanity. And then we anticipate, starting in 2020, I know Jill would like it to happen sooner probably, we'll be doing case management for persons who have been found incompetent to proceed and not restorable within the foreseeable future, or what we commonly refer to as PITPs. I'm sure you're all familiar with PITPs. So thank you for giving us an opportunity to address at least a portion of the task force. I signed up for 10 minutes. I told somebody half tongue-in-cheek the other day because I get paid by the word, or at least I was once asked by a judge if I did. I'm a former public defender. I was a public defender for about 23 years. And then I had a short stint working for the city of Pueblo for a couple of years before joining FCBS in 2016, February of 2016. I signed up for 10 minutes because you all are a captive audience today, and I noticed that a lot of folks weren't signing up, so I figured I'd take advantage of the opportunity.
So I will tell you that we are going to ask you to keep it to 7 or 8 minutes, just to be fair to everyone.
And I promise I will. If I might begin, I'd like to recognize what I think is the most dedicated, compassionate, and professional group of mental health folks I've ever worked with at FCBS. As I said, I've been working with them for about 4 years, and it has been absolutely an honor and a pleasure to work with them. I've been a member of that team since February of 16, and in that time I've been able to marvel at that team's client-centered and care for released NGRIs, and their compassion for what I think is probably one of the most stigmatized and vulnerable populations, not just in Colorado, but nationwide. This team works tirelessly to, literally 24/7, we are on call 24/7, to ensure public safety and patient safety by being available to all of them. And by individualizing care for each of those folks that are placed in the community by one of two legal statuses, either community placement or conditional release. So they respond immediately to any needs that our clients have, any increase in risk, decompensation, substance abuse relapses, etc. And they're extremely creative, compassionate, and responsive in their approach to client challenges, and in order to prevent rehospitalizations and to ensure public safety and safety for our clients. So for that, this team has my undying gratitude, and I just wanted to express that publicly because they have made they've really enhanced my professional life over the last 4 years. So, having said that, as I said, I've been a public defender for a long time. For a short stint, I actually handled all of the mental health cases for the Public Defender's Office for about 2 years. And that's how I first got to know that tremendous staff at FCBS. So I'm hoping that that affords me at least nominal perspective to be able to provide some feedback to the task force. But I've been able to observe the challenges for OBH and for mental health providers and persons suffering from mental illness, I think, from a variety of perspectives. So I'd like to focus my perspective today, if I may, on accountability. Both in the early 2000s, as a result of the Nyberger suit, and most recently, of course, as you all know, the competency lawsuit resulted in the consent decree. OBH and SIMHIP have been challenged to be introspective, to self-reflect, and to identify where we can be better. And I think that's great. I don't think there's anybody here who doesn't welcome that. And I have no quarrel at all with us being scrutinized and being held accountable by disability law and other agencies looking at us from the outside in. We certainly have our shortcomings. I don't think anybody would deny that. But I think that it has enabled us here at FCBS, OBH, and at the hospital to be really honest and introspective about how we might be better. Nevertheless, I would implore the task force to broaden that accountability because, as we all know, this is not a SimHIP problem. This is a state of Colorado problem. And so I'm hoping that that the task force will be able and prepared to hold all of the systems that treat people with behavioral disorders or mental health disorders, hold all of those systems accountable for the dilemma that we now find ourselves in. And I don't want to belabor those points, but I just want to point out some examples. You know, when jails refuse to release an inmate to our hospital police, notwithstanding the fact that they have a court order in hand allowing to take that person and transport them to the Mental Health Institute in Pueblo to provide restoration services or evaluations, those jails need to be held accountable. When county commissioners, in the face of overwhelming evidence that their jails need bare minimum mental health providers to assist folks in crisis in their jails, those county commissioners should be held accountable. When prosecutors, because of dogmatic office policy, object to bond hearings or object to bond release to people who can be treated on an outpatient basis, they should be held accountable. When defense counsel, in my view, abuses, and I'm saying this as a former defense counsel, when defense counsel abuses the statute, the competency statute, simply to gain respite from a difficult client, they should be held accountable. And perhaps most importantly, I think our community mental health system needs to be held accountable. When mental health centers, through a telepsych provider that's 1,000 miles away, dramatically reduces an antipsychotic dosage, or in some instances, discontinues an antipsychotic medication altogether, and then faced with that client's decompensation, refuses to take them into their acute treatment unit, they should be held accountable. When a mental health center puts profitability above staff continuity, and a schizophrenic struggles to find continuity of care when she's in the throes of her mental illness because she's had her 4th or 5th psychiatric provider in a year, or her 3rd or 4th case manager in a year, those mental health centers should be held accountable.
So you have about 1 minute left.
Thanks. And I should be held accountable. When I fail to provide training for those mental health centers, those prosecutors, those judges, those DAs, I should be held accountable. This is not about holding everybody else accountable, but I think it's time for that scrutiny microscope, if you will, that accountability microscope to be turned outward, because unfortunately I think it's been unduly focused on the Office of Behavioral Health and this institute and the mental health providers here in Pueblo. So thanks.
Thank you.